Welcome to today's video about symptoms of liver cancer. Every 30 seconds, someone, somewhere in the world, dies from liver cancer. It's one of the deadliest cancers, yet most people don't realize they have it until it's too late. Could it be happening inside you? Right now? Liver cancer is the third leading cause of cancer-related deaths worldwide. In 2023 alone, over 800,000 people were diagnosed with this silent killer. Yet, the early warning signs are so subtle. Most people ignore them. A little fatigue? A slight change in appetite? Could that really mean something deadly is lurking beneath the surface? By the time the symptoms become obvious, it may already be too late. But here's the good news. If caught early, liver cancer is treatable. So how do you spot the signs before it's too late? What are the 15 symptoms that could mean your liver is in danger? Stay with me, because in the next few minutes, we're breaking down the critical symptoms you need to know. Some of them you'd never expect. Please note, this video is for informational purposes only and is not a replacement for professional medical advice, diagnosis, or treatment. Always consult a healthcare provider for any medical concerns. All research information shared here has been verified by researchers. You can find all references to the studies mentioned in the description below. Now, let's dive into the crucial symptoms of liver cancer, starting with the first one on our list. Persistent fatigue. Feeling persistently tired, even after a good night's sleep, can be more than just everyday fatigue. It might be a sign of liver cancer. When the liver isn't functioning properly due to cancer, it struggles to remove toxins from your blood. This buildup of toxins can make you feel unusually tired and weak. A study published in The Oncologist in 2012 highlighted that fatigue is the most commonly reported symptom among cancer patients, including those with liver cancer. This fatigue isn't just about feeling sleepy. It's a deep exhaustion that rest doesn't fix. The liver plays a crucial role in energy metabolism, and when it's compromised, your body's energy levels can drop significantly. Imagine trying to go about your day, but you constantly feel drained, making even simple tasks seem overwhelming. This kind of fatigue can affect your quality of life, making it hard to work, enjoy hobbies, or spend time with loved ones. If you're experiencing this persistent tiredness, especially alongside other symptoms like loss of appetite or unexplained weight loss, it's essential to consult a healthcare professional. Early detection of liver issues can lead to better outcomes and improve your quality of life. Next, number 2. Change in taste. Experiencing a change in taste can be an unexpected symptom associated with liver cancer. This alteration, known medically as dysgeusia, often manifests as a persistent metallic or bitter taste, making familiar foods unpalatable. The liver plays a crucial role in metabolizing nutrients and detoxifying the body. When liver function is compromised by cancer, metabolic byproducts can accumulate, potentially affecting the taste receptors and altering taste perception. Additionally, liver cancer can lead to elevated levels of certain substances in the blood, which may directly or indirectly influence taste buds. A study published in the Journal of Experimental and Clinical Cancer Research in 2023 highlighted that cancer patients often experience increased taste thresholds, particularly for sweet, salty, and umami flavors, compared to healthy individuals. This means that higher concentrations of these flavors are required for patients to perceive the same taste intensity as before. The research suggests that the cancer itself, rather than treatments like chemotherapy, might be a significant contributor to these taste disturbances. For those undergoing treatment, it's essential to address these taste changes, as they can lead to decreased appetite and potential nutritional deficiencies. Incorporating flavorful herbs and spices, experimenting with different textures, and maintaining good oral hygiene can help manage these alterations. If you're experiencing persistent taste changes, discussing them with your healthcare provider is crucial to ensure comprehensive care. Next, number 3. Bleeding gums or nosebleeds. When the liver isn't functioning properly, it can lead to a decrease in the production of clotting factors, proteins essential for blood coagulation. This deficiency makes individuals more prone to bleeding, even from minor injuries. As a result, everyday activities like brushing your teeth can cause your gums to bleed, and you might experience frequent nosebleeds without any apparent reason. A study published in the World Journal of Gastroenterology in 2015 highlighted that patients with cirrhosis, a condition often leading to liver cancer, experience significant changes in their hemostatic system. These alterations can result in both bleeding complications and thrombotic events. The study emphasized that while traditional tests like prothrombin time and international normalized ratio are commonly used, they don't adequately predict bleeding risks in these patients. This underscores the complexity of bleeding tendencies in liver disease, where the balance between bleeding and clotting is precarious. If you're noticing unusual bleeding, such as frequent nosebleeds or bleeding gums, it's essential to consult a healthcare professional. These symptoms could be early indicators of liver dysfunction, and addressing them promptly can lead to better health outcomes. Next, number 4. Night sweats. Experiencing night sweats can be unsettling, especially when they drench your sleepwear and bedding. While various factors can trigger this symptom, it's important to understand how it relates to liver cancer. The liver plays a pivotal role in regulating body temperature. When cancer affects the liver, it can disrupt this regulation, leading to fluctuations in body heat. As a result, individuals might experience episodes of excessive sweating during the night. Additionally, the body's immune response to cancer often involves the release of certain chemicals to combat malignant cells. This immune activity can inadvertently raise body temperature, prompting the body to cool itself through sweating. A case study published in the Journal of Medical Case Reports in 2021 detailed a young female patient diagnosed with fibrolamellar hepatocellular carcinoma, a rare liver cancer variant. Her initial symptoms included significant weight loss, reduced appetite, and notably, persistent night sweats. This case underscores that night sweats can be an early manifestation of liver cancer, even in younger individuals. It's essential to recognize that while night sweats can be associated with liver cancer, they are also common in various other conditions. If you're experiencing persistent night sweats, especially when accompanied by symptoms like unexplained weight loss or fatigue, it's advisable to consult a healthcare professional for a comprehensive evaluation. Next, number 5. Bad breath. Bad breath can sometimes signal serious health issues, including liver cancer. This specific type of bad breath, known as fetor hepaticus, has a distinct, musty aroma. It's not just a dental concern, but a potential indicator of liver problems. When the liver is compromised by conditions like cancer, it struggles to filter out toxins effectively. One such toxin, dimethyl sulfide, accumulates in the bloodstream. As blood circulates, this compound reaches the lungs and is expelled when you breathe, leading to the characteristic odor. This connection between liver dysfunction and breath odor has been recognized for centuries. Modern research, such as a study published in the Scientific Reports in 2022, confirms that elevated levels of dimethyl sulfide in exhaled air are linked to severe liver diseases, including liver cancer. It's essential to pay attention to persistent changes in breath odor, especially if accompanied by other symptoms like jaundice or abdominal discomfort. Consulting a healthcare professional can help determine the underlying cause and guide appropriate treatment. Next, number 6. Back pain. Experiencing back pain can sometimes be an overlooked sign of liver cancer. This discomfort often arises when a liver tumor enlarges and presses against surrounding tissues or nerves, leading to pain that radiates to the back. Additionally, the liver's proximity to the diaphragm means that an enlarged liver can irritate the diaphragm, causing referred pain in the back or right shoulder. In some cases, liver cancer can metastasize to the spine, leading to back pain. A study published in the Journal of Spine Surgery in 2017 detailed a case where a patient with primary clear cell carcinoma of the liver experienced low back pain due to a solitary metastasis in the lumbar vertebra. This highlights the importance of considering metastatic disease in patients presenting with new-onset back pain and a history of liver cancer. It's essential to recognize that back pain associated with liver cancer is typically persistent and may not improve with standard treatments like rest or physical therapy. If you're experiencing unexplained back pain, especially alongside other symptoms such as fatigue, weight loss, or abdominal discomfort, it's crucial to consult a healthcare professional for a comprehensive evaluation. Next, number 7. Itchy skin. Experiencing persistent itching can be more than just a skin issue. It might signal underlying liver problems, including liver cancer. When the liver's bile ducts become obstructed by a tumor, bile accumulates in the bloodstream, a condition known as cholestasis. This buildup leads to increased levels of bile salts and other substances, which can deposit in the skin and trigger itching sensations. Recent research has shed light on the complex mechanisms behind this symptom. A study published in the International Journal of Molecular Sciences in 2023 highlighted the role of specific molecules like lysophosphatidic acid and its enzyme autotaxin in promoting itch in cholestatic conditions. These findings suggest that elevated autotaxin levels in liver disease patients correlate with more severe itching. It's important to note that while itching is a common symptom in various liver diseases, its presence alone doesn't confirm liver cancer. However, if you're experiencing unexplained, persistent itching, especially alongside other symptoms like jaundice or fatigue, it's essential to consult a healthcare professional for a thorough evaluation. Next, number 8. Frequent hiccups. Persistent hiccups can sometimes signal underlying health issues, including liver cancer. When a tumor enlarges the liver, it may press against the diaphragm, the muscle responsible for breathing, leading to involuntary contractions we recognize as hiccups. This pressure stimulates the phrenic nerve, which controls the diaphragm, causing these spasms. A case reported in the Journal of Medical Case Reports, 2023, highlighted a patient with persistent hiccups due to an enlarging liver cyst. The cyst's growth exerted pressure on the diaphragm, triggering continuous hiccups. This underscores the importance of considering liver abnormalities when diagnosing unexplained, prolonged hiccups. While occasional hiccups are common and harmless, those lasting more than 48 hours warrant medical attention. Such persistent episodes could be an early indication of liver cancer or other serious conditions. If you're experiencing prolonged hiccups, it's essential to consult a healthcare professional for a thorough evaluation. Next, number 9. Feeling of fullness or bloating. Experiencing a sensation of fullness or bloating can be an early indicator of liver cancer. This occurs when the liver enlarges due to tumor growth, exerting pressure on surrounding organs and tissues. Such pressure can lead to discomfort and a persistent feeling of being full, even after consuming small amounts of food. Additionally, the accumulation of fluid in the abdomen, known as ascites, contributes to bloating and abdominal distension. Ascites develops when liver dysfunction causes fluid to leak into the abdominal cavity, resulting in noticeable swelling and discomfort. This fluid buildup not only causes physical discomfort, but can also impact appetite and overall digestion. According to a study published in the Journal of the American Medical Association in 2020, ascites is a common complication in liver cancer patients, significantly affecting their quality of life. If you're experiencing persistent bloating or a sense of fullness, it's essential to consult a healthcare professional for a thorough evaluation. Next, number 10, swollen legs and ankles. Experiencing swelling in your legs and ankles can be unsettling, especially when it's linked to liver cancer. This swelling, known as peripheral edema, occurs when excess fluid accumulates in your body's tissues. In the context of liver cancer, several factors contribute to this condition. One primary cause is the development of ascites, which is the buildup of fluid in the abdomen. As liver cancer progresses, it can lead to increased pressure in the liver's blood vessels, causing fluid to leak into the abdominal cavity. This fluid can then seep into the tissues of the legs and ankles, leading to noticeable swelling. The National Cancer Institute notes that cancers near the pelvic veins, such as liver cancer, are more likely to cause edema in the legs or feet. Additionally, liver cancer can obstruct blood flow through the liver, resulting in portal hypertension, elevated blood pressure within the portal vein system. This increased pressure can cause fluid to accumulate in the lower extremities. Moreover, a compromised liver may produce fewer proteins like albumin, which helps keep fluid inside blood vessels. A decrease in albumin levels allows fluid to leak into surrounding tissues, causing swelling. A case reported in the Journal of Clinical and Experimental Hepatology in 2022 highlighted a patient with liver cirrhosis experiencing significant leg swelling due to massive ascites. Imaging revealed extensive fluid accumulation in the abdomen and right thigh, underscoring how severe liver conditions can lead to peripheral edema. If you're noticing persistent swelling in your legs and ankles, it's essential to consult a healthcare professional. Early detection and management of liver-related issues can significantly improve outcomes and enhance your quality of life. Next, number 11. Dark urine. When liver cancer impairs bile production or flow, bilirubin, a yellow pigment, accumulates in the bloodstream. This buildup not only leads to jaundice, but also causes urine to darken, often appearing tea-colored. The National Health Service, NHS, notes that jaundice can result in darker urine and paler stools than usual. A study published in the JAMA Oncology in 2016 highlighted that elevated bilirubin levels are a significant indicator of liver dysfunction. Researchers found that patients with liver cancer often present with hyperbilirubinemia, leading to noticeable changes in urine color. This underscores the importance of monitoring such symptoms for early detection. If you observe persistent darkening of your urine, especially when accompanied by jaundice or other symptoms like abdominal pain, it's essential to consult a healthcare professional promptly. Early evaluation can lead to timely diagnosis and improved treatment outcomes. Next, number 12. Loss of appetite. Experiencing a diminished desire to eat can be an early indicator of liver cancer. The liver is essential for digestion and metabolism, so when it's compromised by cancer, these functions can be disrupted, leading to a reduced appetite. One reason for this change is that liver tumors can produce hormones and other substances that affect your body's metabolism and appetite signals. This can make you feel less hungry or full sooner than usual. Additionally, the presence of a tumor can cause inflammation, which may further suppress appetite. A study published in the Journal of Cachexia, Sarcopenia, and Muscle in 2024 highlighted that approximately 40% of cancer patients reported a decreased appetite since beginning treatment, with early satiety being a significant factor. It's important to note that loss of appetite can lead to unintentional weight loss and malnutrition, which may weaken the body and complicate treatment. If you're experiencing persistent changes in your appetite, especially if accompanied by other symptoms like abdominal discomfort or jaundice, it's crucial to consult a healthcare professional promptly. Next, number 13. pale or chalky stools. When your liver isn't producing enough bile, or when bile flow is obstructed, it can lead to pale or clay-colored stools. Bile, a digestive fluid produced by the liver, gives stool its typical brown color. In liver cancer, tumors can block bile ducts or impair bile production, resulting in lighter-colored stools. A study published in Gastroenterology in 2018 highlighted that symptoms like white, chalky stools are associated with liver cancer. This occurs because the cancer obstructs bile flow, preventing it from reaching the intestines to aid in digestion. If you notice persistent changes in stool color, especially to a pale or clay-like hue, it's essential to consult a healthcare professional. Early detection of liver issues can significantly impact treatment outcomes. Next, number 14. Jaundice. When liver cancer develops, it can interfere with the liver's ability to process bilirubin, a yellow pigment formed from the breakdown of red blood cells. Normally, the liver filters bilirubin from the blood, excreting it into the bile ducts to be eliminated through stool. However, cancerous growths can obstruct these bile ducts or damage liver cells, leading to a buildup of bilirubin in the bloodstream. This accumulation causes the skin and eyes to take on a yellowish hue, a condition known as jaundice. A recent study published in the World Journal of Gastroenterology in 2024 highlighted that approximately 19% to 40% of patients with hepatocellular carcinoma, the most common type of liver cancer, present with jaundice at diagnosis. The research indicates that this jaundice often results from extensive tumor infiltration into the liver tissue or invasion into the bile ducts, disrupting normal bile flow and bilirubin excretion. It's important to note that jaundice can also be associated with other conditions, such as gallstones or hepatitis. Therefore, if you notice yellowing of your skin or eyes, it's essential to consult a healthcare professional promptly for accurate diagnosis and appropriate management. Next, number 15. Frequent infections. When liver cancer develops, it often stems from chronic infections like hepatitis B or C. These persistent infections can weaken the immune system, making the body more susceptible to other infections. A study published in the Journal of Gastroenterology in 2017 highlighted that chronic hepatitis infections are responsible for at least 80% of all liver cancers. As liver function deteriorates due to cancer, its ability to produce essential proteins, such as those involved in immune responses, diminishes. This decline hampers the body's defense mechanisms, leading to an increased frequency of infections. Research indicates that patients with advanced liver disease often experience infections in the respiratory and urinary tracts, with studies showing respiratory infections in 50% and urinary tract infections in 28% of cases. Moreover, the liver plays a crucial role in filtering toxins and pathogens from the blood. When compromised by cancer, its filtration efficiency decreases, allowing more pathogens to circulate and cause infections. Therefore, if you or someone you know with liver cancer is experiencing frequent infections, it's essential to consult a healthcare professional promptly. That's it for today's video. We've covered the 15 warning signs of liver cancer, some obvious, some shocking. But now, you know what to watch for. Knowledge saves lives, and early detection is key. If this video helped you, type "helpful" in the comments below. Your support motivates us to create more life-saving content. And before you go, don't forget to hit that like button, subscribe, and turn on the notification bell, because we have more critical health topics coming soon. Stay informed, stay healthy. We'll see you in the next one.